English-only Filipino nurses' journey to equality. In 2012, a group of Filipino nurses and staff at Delano Regional Medical Center in California won a nearly $1 million settlement in a language discrimination case. They were targeted for speaking Tagalog and other Filipino dialects, even in break rooms and private conversations, while other employees who spoke Spanish, Hindi, or Bengali were left alone. This wasn't about English proficiency, it was about discrimination. Filipino nurses are among the most linguistically capable professionals in the U.S. healthcare system. They are highly proficient in English, often fluent in multiple Filipino dialects, and deeply skilled in cross-cultural communication. The issue at Delano wasn't their ability to speak English, it was the weaponization of language to isolate and humiliate them. The hospital's English-only rule was enforced almost exclusively against Filipino workers. Managers reportedly encouraged staff to act as language vigilantes, creating a hostile environment where Filipino accents were mocked and casual conversations were policed. Even Filipino food became a target of ridicule. The rule became a tool of fear, silencing cultural identity and undermining dignity. But the lawsuit wasn't just a legal win, it was a moral one. It affirmed that language can't be used to exclude, and that bilingualism in healthcare is a strength, not a threat. Filipino nurses bring more than clinical skill. They bring connection. Their ability to speak Tagalog, Ilocano, and other dialects transforms care for new migrants who may feel lost in a system they don't yet understand. When a nurse speaks a patient's native language, it improves safety. It ensures the patient understands their diagnosis, treatment, and medication. It builds trust, reduces anxiety, and encourages patients to share personal health concerns. It empowers them to make informed decisions, and it honors their culture. Because language and healing are deeply intertwined. Filipino nurses also understand the cultural nuances that shape beliefs about health, family, and spirituality. They offer care that's not just medically sound, but emotionally resonant. In a system where limited English proficiency often leads to worse outcomes, the Delano case forced the hospital to revise its language policy, conduct anti-harassment training, and submit to federal monitoring. But the deeper lesson is this: Filipino nurses should never be punished for speaking the language of their heritage. Their voices carry comfort, clarity, and compassion. They are not a liability, they are a lifeline. Filipino nurses should be celebrated for their linguistic and cultural fluency, not punished. Their voices, whether in English, Tagalog, Ilocano, or any of the Philippines' rich dialects, are voices of healing. They carry stories, comfort, and clarity. They deserve dignity, not discrimination. Filipino nurses are known for their loving and caring nature, dedicating their hearts and souls to patient care. Their compassion, strong work ethic, adaptability, and strong communication skills, particularly in dedication to patient well-being, and commitment to going the extra mile in their profession. Their strong cultural values, often rooted in faith, foster a patient-centered approach, and their ability to blend into diverse healthcare environments makes them highly sought after globally. English is widely spoken and understood in the Philippines, making Filipino nurses proficient communicators. This linguistic skill, combined with effective verbal and written communication, they are diligent and dependable professionals committed to providing the best possible care, ensuring patient well-being and working to alleviate suffering. Let us celebrate their voices. Let us protect their right to speak. Because when Filipino nurses speak their language, they don't just communicate, they heal.